Good morning, all. I, Dr. Vijayalakshmi Nalavadi, Professor and Head, Department of Repertory, Dr. B.D. Chetty Holistic Medical College, Dharwad, Karnataka, welcome you all to this comprehensive program designed to support your preparation for All India AYUSH Postgraduate Entrance Test. I would like to welcome our today's chief guest, Shri Iresh P. Anchitigeri, sir, Working President, DBHPS, former Mayor, Hubli Dharwad Municipal Corporation. I would like to welcome Dr. Anand Vasur, Principal, Dr. B.D. Chetty Homeopathic Medical College, Dharwad. I welcome today's resource person, Dr. Kiran Kumar G, full-time consulting homeopathic physician at Sri Clinic, Bangalore. Here, I am welcoming the team of JIGNASA Karnataka for online platform for this function. I welcome all the participants from different college and different states. Welcome you all. As you embark on this journey, the AIAPGET orientation program is designed to provide aspiring candidates with the AIAPG, its pattern and preparation strategies. Expert faculty and resource persons will guide you through the exam pattern, syllabus, and preparation strategies, helping you stay focused and motivated. The key highlights of this journey is exam pattern, preparation tips, time management, series of mock tests, expert guidance, and support. I hope this program will boost confidence and performance in the exam. Now, let me call Dr. Kiran Gaddi, Professor and HOD, Department of Metra Medica, Dr. B.D. Chetty Homeopathic Medical College, for a brief introduction about our institution.
Respected dignitaries, teachers, resource persons, and dear participants. Dakshin Bharat Hindi Prachar Sabha's Dr. B.D. Chetty Homeopathic Medical College, Hospital, Postgraduate Research Center, Dharwad, is serving in the field of homeopathic education and healthcare service since 1992. Postgraduate Research Center was added in 2002, so we have 23 years of postgraduate legacy of education. We have a total of 17 postgraduate seats in the subject of homeopathic metra medica, organ of medicine, repertory, and practice of medicine. The students passed out of this institute have dedicated themselves to the field of homeopathy by practicing this rational system of medicine as committed homeopathic clinicians and academicians. There are 52 qualified, highly experienced, dedicated faculty members in our college. On the rolls and 25 efficient non-teaching staff, the hospital has 44 staff who are providing healthcare services. All the departments of this institution are having state-of-art laboratory and museum, rich with departmental library and teaching aids as per the need of requirements of apex bodies. Now, let me tell you regarding our PG students' achievements. Our postgraduate student, Dr. Krishna Ekka from Department of Homeopathic Mathematics, received a scholarship for quality dissertation in homeopathy by Central Council for Research in Homeopathy in the year 2019. Since then, every year, our students are being shortlisted under CCRS scholarship for quality MD dissertation in homeopathy. Our PG students, Dr. Tanzila, secured second prize, and Dr. Aluvishnu Sai Vardhan secured third prize in national level essay competition organized by Karnataka Qualified Homeopathic Doctors Association, Bangalore in 2023. Our postgraduate students have presented papers and have done poster presentations regularly in national level conferences. Our postgraduates have come up with flying colors at university exams. The 2021 batch has secured 6 ranks at university, and 2020 batch has secured 5 ranks. 2019 batch has secured 5 ranks, and this is regularly we are getting ranks at the university. 19 November 2024 is a proud moment for all of us. Our college got A+ grade by Quality Council of India. Out of 216 homeopathic medical colleges in India, only 42 colleges got this recognition. In Karnataka, out of 18 homeopathic medical colleges, 5 have got this recognition. This year, we are starting with orientation program and mock test for AIapget exam. I hereby call upon you all to take the benefit. Put your queries in the WhatsApp group made for this purpose and to take expert help from the teachers and the resource persons. Thank you.
Now I request our principal, the program initiator, the dynamic principal, Dr. Anand Vasur, for addressing this orientation program.
Good morning all, and welcome to this online session of AIapget 2025 orientation as well as the mock test regarding that. This is the inaugural session. I welcome all the students across the country who have joined this unique program, which is hosted by Dakshin Bharat Hindi Prachar Sabha's BD Jati Homeopathic Medical College, Dharwad, in association with JIGNASA. This concept has erupted into my mind to make students to motivate to take more number of students to take this AIapget for every year, so that many students will not be able to understand what is the context and what is the pattern of examination, how to crack it, how the pattern of questions are there. In that way, when we discussed with many students who were in the undergraduate, they expressed their desires to understand this concept of examination. So the JIGNASA, which is working for AYUSH student, when we discussed with the students of who are associated with JIGNASA, they also expressed that why we can't reach more number of students. Then we associated our college with the JIGNASA. This JIGNASA, which is working for the all the problems of AYUSH students, as well as the motivation to these AYUSH students with the idea of learn AYUSH to practice AYUSH. So in that sense, the JIGNASA is working across the country in all AYUSH faculties with the hope of making skill development, making workshops, making different exposure visits, and also involving into the policy advocacies. So through that JIGNASA platform, and also from the whole faculty of our college who are involved in this workshop, as well as making this very unique mock test, which are having that tendency of last years and what are the competency levels of that questions they have worked out. Hope these mock tests will help these aspirants of AIPGT for their actual examination. This is not the actual form of examination, but it is like a practice session which help them to crack this examination, and hope most of the students from this group will be qualified for PG entrance examination, and hope many of them take admission into the PG course, and through that our system, the homeopathic system, will take to the higher level, to the research and other field of areas. I once again welcome all of you for this online session, inaugural session, and hope you will enjoy hold this mock test and it will be utilized for your lifetime. Thank you very much.
Thank you, sir. It is my great pleasure to welcome today's chief guest, Shri Aiyash Antchitgiri sir, for the inauguration ceremony of AIAPGT orientation program. Sir, I request you to inaugurate this function. Thank you, sir. Now I request our working president, Sri Aiyash Antchitgiri, to talk a few words regarding this orientation program.
दक्षिण भारत हिंदी प्रचार सभा डॉक्टर बीडी जत्ती होमियोपैथी मेडिकल कॉलेज हास्पिटल एंड पोस्ट ग्रेजुएट ಸೆಂಟರ್ನ ಈ ಒಂದು ವಿಶೇಷವಾದಂತ AIPGT ವಿದ್ಯಾರ್ಥಿಗಳಿಗೆ 2025ರ ಅನುಕೂಲ ಆಗೋ ದೃಷ್ಟಿಯಿಂದ ಆನ್ಲೈನ್ ಓರಿಯೆಂಟೇಷನ್ ಪ್ರೋಗ್ರಾಮದಲ್ಲಿ ಉಪಸ್ಥಿತಿರುವಂತ ಈ ಪ್ರಾಂಶುಪಾಲರಾದಂತ ಡಾಕ್ಟರ್ ಆನಂದ್ ಸೂರ್ ಅವರೇ ಹಾಗೂ ಎಲ್ಲ ಶಿಕ್ಷಕರೊಂದಿಗೆ ಮತ್ತು ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮವನ್ನು ವಿಶೇಷವಾಗಿ ಪ್ರಥಮ ಬಾರಿಗೆ ಜಿಜ್ಞಾಸಾ ಕರ್ನಾಟಕ ವತಿಯಿಂದ ಹಮ್ಮಿಕೊಂಡಂತ ಈ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಉಪಸ್ಥಿತಿರುವಂತ ಎಲ್ಲ ವಿದ್ಯಾರ್ಥಿನಿಯರೇ, ತಮ್ಮೆಲ್ಲರಿಗೂ ದಕ್ಷಿಣ ಭಾರತ ವಿಶ್ವವಾದ ಡಾಕ್ಟರ್ ಬಿಡಿ ಜತ್ತಿ ಹೋಮಿಯೋಪತಿ ಕಾಲೇಜ್ ಪರವಾಗಿ ತಮ್ಮನ್ನ ಉತ್ಪೂರ್ವಕವಾಗಿ ಮತ್ತೊಮ್ಮೆ ಸ್ವಾಗತವನ್ನು ಕೋರ್ತಾ, ವಿಶೇಷವಾಗಿ AIPGT ವಿದ್ಯಾರ್ಥಿಗಳು ಯಾವ ರೀತಿ ಪರೀಕ್ಷೆ ಬರೆಯುವ ಮೂಲಕ ತಮ್ಮ ಮುಂದಿನ PGಯನ್ನ ಅಡ್ಮಿಷನ್ ಸಲುವಾಗಿ ಅನುಕೂಲ ಆಗುವ ದೃಷ್ಟಿಯಿಂದ ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮಗಳನ್ನ ಇಡೀ ದೇಶಾದ್ಯಂತ ವಿದ್ಯಾರ್ಥಿಗಳಿಗಾಗಿ ಅದು ಉಚಿತವಾಗಿ ಹಮ್ಮಿಕೊಂಡಂತ ಈ ಕಾರ್ಯಕ್ರಮವನ್ನ ಬಹಳ ಅಚ್ಚುಕಟ್ಟಾಗಿ ಇದರ ಸದುಪಯೋಗಗಳನ್ನ ಬಳಸುವ ಎಲ್ಲ ವಿದ್ಯಾರ್ಥಿಗಳು ಬಳಸ್ಕೋಬೇಕು. ಈಗಾಗಲೇ ನೀವು UGಯಲ್ಲಿ ನೀಟ್ ಮೂಲಕ ಕ್ವಾಲಿಫೈ ಆಗೋ ಮೂಲಕ ಮುಂಬರುವಂತ AIPG ಏನು ಭಾರತ ಸರ್ಕಾರ ಹಮ್ಮಿಕೊಳ್ಳುವಂತ ಈ ಪರೀಕ್ಷೆಯಲ್ಲಿ ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮದ ನಮ್ಮ ಉದ್ದೇಶ ಅಂದ್ರೆ ತಮಗೆ ಸದುಪಯೋಗ ಆಗಬೇಕು. ಯಾವ ರೀತಿ ಪ್ರಶ್ನೆಗಳನ್ನ ಅದರಲ್ಲಿ ಬರ್ತವೆ, ತಾವು ಯಾವ ರೀತಿ ಅದನ್ನ ಬಿಡಿಸಬಹುದು ಮತ್ತು ಅದರಲ್ಲಿ ತಾವು ಪಾಸ್ ಆಗುವ ನಿಟ್ಟಿನಲ್ಲಿ ಹೆಚ್ಚು ಅಂಕಗಳನ್ನ ಗಳಿಸುವಂತ ದೃಷ್ಟಿಯಿಂದ ಈ ಕಾರ್ಯಕ್ರಮಗಳನ್ನ ಹಮ್ಮಿಕೊಳ್ಳಲಾಗಿದೆ. ತಾವೆಲ್ಲ ವಿದ್ಯಾರ್ಥಿಗಳು ಸಂಪೂರ್ಣವಾಗಿ ಇದರ ಕಾರ್ಯಕ್ರಮದ ಭಾಗವಹಿಸಿ ಇನ್ನು ಹೆಚ್ಚು ವಿದ್ಯಾರ್ಥಿಗಳಿಗೆ ಈ ಕಾರ್ಯಕ್ರಮ ಕುರಿತು ತಿಳಿಸುವ ಮೂಲಕ ತಾವೆಲ್ಲರೂ ಭಾಗವಹಿಸಿ ಯಶಸ್ವಿ ಆಗ್ತೀರಾ ಅಂತ ಹೇಳ್ತಾ, ಮತ್ತೊಮ್ಮೆ ಭಾಗವಹಿಸಿದ ವಿದ್ಯಾರ್ಥಿಗಳಿಗೆ ಹಾಗೂ ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮವನ್ನ ಬಹಳ ಅಚ್ಚುಕಟ್ಟಾಗಿ ಹಮ್ಮಿಕೊಂಡಂತ ನಮ್ಮ ಡಾಕ್ಟರ್ ಆನಂದ್ ಸೂರ್ ಅವರೆಲ್ಲ ಟೀಮ್ಗೆ ನಾನು ಅಭಿನಂದನೆಗಳನ್ನು ಹೇಳ್ತಾ ನನ್ನ ಉದ್ಘಾಟನೆ ಮಾತಾಡ್ತೀನಿ. ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ.
Thank you, sir. Now, please join us in welcoming Dr. Kiran Kumar ji, consulting homeopathic physician, has been actively involved in Karnataka's first ET-Tech platform, Homeo Elite, for competitive exam preparation in homeopathy. He has secured an All India rank 118 and Karnataka state rank 3 in AIAPGT 2021. Now he is working on evidence-based homeopathy in various veterinary clinical conditions. Now Dr. Kiran Kumar will be sharing his valuable insights and expertise with us today on AIAPGT preparation strategies. We are confident that his knowledge and experience will greatly benefit our participants. Over to Dr. Kiran.
Session. Yeah. Hello everyone.
Yes, Dr. Kiran Kumar, we can hear you.
Yeah. Is the screen visible, madam? PPT is visible?
Yeah, it is visible.
Yeah, fine.
Can you put it in presentation mode?
Yeah, 1 second. Yeah, is the PPT visible?
Yeah, visible.
And how about voice? Voice is clear?
Yeah, it is very clear. Carry
Yeah,
on. Carry on.
yeah. Hello everyone. A very good morning to one and all present here, and the dignitaries Iresh sir and also Principal Dr. Anand Hosur sir, BDJHMC, and also and all the HODs of the concerned departments and all the staffs present here in this session, and also my dear students. Okay, so for whom this session will be benefited. Okay, so we'll start with today's session. Before I start with the actual session, okay, so now that you are all graduated, okay, so now you are all doctors and you have additional responsibilities as far as the society is concerned. So here also at the end of the 5.5 years of BHMS, so the question will always remain, what's next? Okay, so this is the quite common question with majority of the students as far as the BHMS is concerned. So few might take up a practice as soon as the BHMS is completed. Few might work under some specialists or work under some expert homeopaths, and they get trained under them. And few might choose a path which is not it's kind of deviation, or what we call it as the for their higher purpose. They might take up UPSC or even the civil services or any entrepreneurship. Okay, so these are the questions that will always constantly remain after the AIPGT examination. Okay, so now as far as the AIPGT examination is concerned, okay, so now I hope there are three set of students. I have broadly classified the students of BHMS into three set of students. So here you can see the first one are the doctors who have completed their internship already, and they are already preparing for examination for AIPGT since a long year. Maybe since 1 year, they might have 2018 batch might have completed their AIPGT. Okay, so their BHMS, and they are being preparing for AIPGT. And then there are interns, so who are busy with their clinical postings, and even in the completion regarding dissertation. Okay, so they get a little comparatively to the others, so they might get a little less time. Okay, and we also have lady doctors who have the other responsibilities. Okay, so simultaneously with their responsibilities, they are also taking up the AIPGT examination. Okay, so this is AIPGT orientation session by BDJT Homeopathic Medical College in association with Homeo Elite and also JIGNASA. Okay, so myself, I am Dr. Kiran Kumar Ji. So I secured my All India rank 118. So in AIPGT 2021. So I am also faculty of Materia Medica at Homeo Elite. So now the agenda of today's session is, okay, so at the end of the session, the learner will be able to list the importance of MD homeopathy, understand the AIPGT examination pattern, and also you can enumerate the subject-wise marks weightage of the particular examination. Okay. So we'll start with the threefold of MD homeopathy. So now majority of the students will have this question now that we are all doctors. So of course we can practice now. So definitely that is a very good idea if you are practicing. But at the same time, what is the benefits of using MD homeopathy as far as your excellence? Okay, as far as your personal growth is concerned. So you can see the first major thing, as you know, it's a clinical practice. Okay, so when you join some reputed institutes, okay, so you get to meet many HODs, many principals, and many practitioners. Okay, and that will definitely improve your clinical skills. And also at the same time, so in the PG, what happens is you might have students from different states. You might have your seniors who are appearing this year and they are cracking this year, and they becomes your colleagues. Okay, so when that happens, what exactly happens is you get to share knowledge, and you also get to gain knowledge from their clinical experiences. Okay, so their practice might be different. They might have seen some pathologically deep advanced cases. Their approach to cases can be different. So with that, your knowledge horizon will improve. So that is the clinical part. And moving on to the next important aspect, is the teaching. Okay, so you also tend to teach your UG students and also interns. So with that, you can also become a good teacher, as well as you can share your clinical insights, okay, with your with your juniors as well. And tomorrow you can see what happens when you become a good teacher. Okay, you create more number of good students. Okay, so that is one impact you can make on the society. Okay, so and then last and the most important part is the research. Okay, so why I'm saying research, because see, whatever you do, it has to be evidence based. Okay, so it has to be agreed by all system of medicine, because homeopathy we have remarkable results. Okay, so that is why even CCRH has been no, supporting students. Maybe a majority of the UG students might be knowing there is a SDSS scholarship program for no, students who are interested in research. Okay, so keeping these are the three folds. One is clinical or the clinical skills as a practitioner, and then you also have a teacher. Okay, then you can also be a research person. Okay, so and what are the MD after MD opportunities? Okay, is the most important thing. So as you can practice with BHMS, but this is the most important thing. What are the uses of the MD examination? Okay, the first thing is, even in the rural areas, they know what is basic degree and what is the MD degree. Okay, so usually whenever there is two options, usually doctors or the patients prefer to go for MD. Okay, so here you can also see. Okay, so here you can also see, here you can see the clinical practice perspective. Okay, so one is the most important, that's the clinical practice. You can be an MD doctor. Okay, so and the next important thing is, tomorrow if you are joining any teaching colleges in India as an assistant professor to teach the student, MD is a mandatory degree. Okay, so if you are not no if you are not pursued your MD, so you will not be able to teach in a college. Okay, so as per NCH, you are not eligible to teach. Okay, so tomorrow you can join as assistant professor, later you can become associate, then professor, and followed by that you can become a HOD or even PG guides. Okay, so if there is a PG college like in BD Jati, we have PG, departments. Okay, so there also you can join as an opportunity. Okay, so then the most important thing is the UPSC, a medical officer. Okay, the Union Public Service Commission. So there is an examination for UPSC MO. If you crack that examination, so you can become a medical officer at the national level. Okay, so this examination will be conducted occasionally once in a while. Okay, so the most important thing here is, for in the UPSC MO also, so you can be BHMS candidates are little lesser preferred whenever there is an MD candidate. Okay, so whenever usually people are preferring MD doctors than the BHMS doctor. So this is one of the opportunities of MD. And then the research officer, to make homeopathy more scientific. Okay, and to make more evidence based. So what they are doing is, so there are posts of research officer in Delhi, in Vizag, and in different no, peripheral research centers. Okay, where you can become a research officer. Okay, so research officer, definitely you in the PG curriculum, you will be told about what is research and what are the types of studies which comes under research, and how you have to do research, and also regarding the publication of the papers, scientific papers in peer reviewed journals. So that becomes a very important aspect, and you can also be a research officer. Okay, in UPSC MO and in research officer, the salary is also very high. Okay, and then the state PSC. So as far as the other states are concerned, you have state PSC, and then you also have NHM examinations like National Health Missions, and you can also work in NAM. Okay, National AYUSH Missions, and also PHC. Okay, and the more important, recently when I was preparing for this presentation, so there was a notification from the NCH that they are doing the specializations. Okay, so specialization, that is after MD. I'll be telling that regarding in the next slide. Okay, so what are the subjects that are offered in the MD homeopathy? Okay, so in BHMS you have studied all the subjects, but in MD it is not that way. Okay, so in MD what exactly happens is, one second. Yeah, yeah, in MD what exactly happens is, so here the subjects in the MDR, you have organon of medicine. Okay, so and you also have materia medica, and you also have repertory and pharmacy as far as the homeopathic subjects is concerned. Okay, so exactly you can study and master these subjects, and there will be only one individual subjects. Along with that, you will be having advanced teaching. Okay, and you will you will be having advanced teaching, and you also have research examination, research subjects for MD homeopathy subjects. Okay, so then you can also see the allied subjects like practice of medicine, pediatrics, and psychiatry. Okay, and recently 2 years back there are two new subjects that are added, that is MD homeopathy in dermatology and also MD in preventive and social medicine. Okay, maybe in this year you might know, have this subject as an option as well. Okay, so here you can see. So, and after MD, you can also pursue a degree called as Doctor of Homeopathy. Recently, 2 weeks back, NCH has released a notification that after your MD, it is a super specialty. Okay, so after your MD, you can do your super specialty. Okay, so the super specialty is they have given 6 super specialty subjects. Okay, the first one is the medical oncology. So this is after MD, I am saying. Maybe there can be other new courses or even research oriented studies that can come up later. So one is medical oncology, and then you also have pediatric psychiatry, and then you also have clinical immunology, and then the clinical rheumatology. Okay, so then you also have pulmonary medicine and also the endocrinology. Okay, so these are the 6 super specialty subjects added after MD homeopathy. You can do MD homeopathy in any subjects. Okay, but after your MD homeopathy you can take up DM. Maybe by the time you are graduated, okay, when you give APGT 2025 and you are graduated in the next 3 years, you will definitely, by that time this course will be launched and you can get enrolled for this. Again, for this there is an examination, so which you have to compulsorily attend. If you crack that in good marks, you can get into these specialties. Okay, so now as far as AIPGT is concerned, okay, so in the BHMS you will be used to writing questions like long essays, short essay, and even the short answer kind of questions. Okay, so this you can check. Okay, so then this is the basic ideal of how you were writing your UG examination. But as far as AIPGT examination is concerned, so you will be given 120 questions. I repeat once again, you will be given 120 questions, and 120 question is common for all the aspirants who are writing for AIPGT. Okay, you can be from Karnataka, you can be from Kerala, you can be from Delhi, you can be from, no, you are a candidate from Calcutta or even a candidate from Gujarat. Everybody, this examination is common. This is a national level examination. Okay, so in this examination, so the most important thing or the most valuable thing about, or maybe it can be, both advantage as well as the disadvantage for many students. So the most important thing is, for each correct answer you will be allotted 4 marks. Okay, so very important, for each correct answer you will be allotted 4 marks. Okay, plus 4 marks. For example, one question if you answer, it is 4 marks. Second question if it is correct, it is 8 marks. So that way. And also the good part, or even the good part or even the bad part of the AIPGT examination is, okay, you will be having one negative mark. Okay, if you answer the particular question wrong, you will be having one negative mark. So this has played a very important role in students who has got a better rank, like single digit, double digit, and rank below 150. And also it has caused a disaster if you are not managing the time and if you are not strategically approaching the examination. It has caused a disaster because of the negative marks. Okay, so now we'll start with the number of questions. So now there is 120 questions. So now basically you are cracking this examination for homeopathy, right? So for the homeopathic subjects you are cracking the examination. Okay, so here in the homeopathy subjects, so you have two parts. So basically one is 60 questions. So out of 160 questions, you will be having homeopathic subjects 60 questions, and then you will also have allied subjects. So when I say allied, other than homeopathy, whatever subjects are there, that is considered to be allied. Okay, so here you can see these are the, out of 120 questions, this is an approximate thing. Usually 50% of the marks or 50% of the questions are asked from the AIPGT. Okay, so then here you can also see what are the major subjects. Okay, so these are the major subjects. Okay, one is materia medica, and one more important aspect is in these 60 questions of homeopathic subjects. Okay, so the 60 questions are asked from 4 homeopathic subjects. So one is materia medica, organon, repertory, and homeopathic pharmacy. If you are studying these 4 subjects very thoroughly, if you are trying to master it, no, literally, because there are hardly 30 days left. Okay, if you try to understand and study these subjects very well, you can score literally good marks, and also you can get a very good rank. Okay, So now you can also, in the allied part, you also have medicine, surgery, OBG, and you also have OBG as well as the surgery. So these are the 8 subjects. This I consider to be the major subject, because if you are not studying these subjects, please don't attend AAPGT. Okay, so you can study for next year and then you can attempt. Okay, because if you are not studying, okay, so if you are not studying these subjects, it is a recipe for huge disaster, and you will end up in sometime not even qualifying also. Okay, because these are the major subjects where the questions are asked. Anyway, you have some basic knowledge of homeopathy subjects because you have passed your BHMS examination. You have a basic level knowledge. Okay, you have the fundamental understanding of the subject. Only thing now what is required is the tuning of this particular subject. Okay, so these are the major subjects, and this is the subject wise weightage. I have taken it from Homeo Elite Instagram page. So here you can see the subject wise weightage. It was released by AIPGT 2024 by the NCH. Okay, so here you can see. So Materia Medica, Organon, Repertory and Pharmacy covers the 50% of the marks in AIPGT, and then the rest 50% is allied. Okay, so this is in the percentage. I have tried to show the graph here. So in the next thing, so you can see, if you ask what subjects to study, as I told, the major subjects is the one thing you have to study. If you see the individual subject marks weightage, okay, so out of 120 question, you have Materia Medica 16 questions, Organon 16 questions, Repertory 16 questions. So these are the 3 major subjects, very important for your practice as well. So these 3 subjects are having the major marks. Okay, so literally if you study pharmacy and all the 3 homeopathic subjects, you will be able to attend 60 questions. Okay, so at least you could be able to attend 60 questions. Okay, and then you also have practice of medicine, which is the highest in the allied. So practice of medicine is the highest in the allied. Okay, and then you have surgery 8 questions, OBG 8 questions. So OBG, obstetrics as well as gynecology included, it is having 8 questions. And then the other subjects, whatever I told, it is community medicine is also one of the important subject. Okay, where you have 9 questions from the community medicine. And then here you can see anatomy, physiology, pathology, FMT. So these are first and second year BHMS subjects. These are considered to be minor subject, because see, now if you are aiming for a better rank and you are already preparing for 1 year, okay, so what you can do is, so you can study all the subjects. Okay, but what happens exactly, you are left with only 30 days. Please remember this, you are at the very crucial point of your life. Okay, you are at the very crucial stage of your AIPGT preparation. So this part is very important. So as per the subject weightage, you have to prepare. Okay, there is no point in preparing, say for example, now there is no point in studying all the anatomy concepts, head and neck, upper limb, lower limb, everything you are studying, and when you go for the examination, there is only 5 questions asked. Okay, so whereas the person who have studied the better, like organon well, repertory well, okay, so they will score more marks compared to you. So this is why it is important to approach the exam in a strategic manner. Okay, so and homeopathic subjects, okay, this is the gem of the subjects to score marks. Okay, because you are anyway, so you are the questions are not asked from political science, not from the history, not from the economics. The questions are very clearly asked from the homeopathic subject. So this was the weightage asked in the previous year. So there can be 1 or 2 question variation. Say for example, there was 15 questions in Materia Medica, 17 from repertory. So like that, 1 or 2 question can be vary, but approximately 50% questions will be homeopathic, rest 50% will be allied. Okay, so these are the 4 subjects. The first subject you should always try is organon of medicine. Okay, because organon of medicine, the content is less and the marks is more, and then you can choose repertory also. Materia Medica, as there are n number of symptoms, I would suggest you to study every day. Materia Medica, you have to study every day. You have to revise, do multiple revision. And pharmacy is also 12 marks, but you have a fundamental knowledge. Maybe there are few factual information which you have to study. Okay, so and these are the allied part. Allied, as you told, practice of medicine, though it has majority of the marks, but it is very vast. Okay, right from your rheumatology, cardiology, neurology, nephrology, pulmonology, okay, and hematology, even endocrinology. So all the questions, so that you can get 1 question from 1 system. So that's why 16 marks are there, but no, it is kind of little less scoring. Okay, comparatively to the homeopathic subjects. And SPM also 9 questions are asked. Okay, and it's very important also when you're studying SPM, try to see some recent advances. Say for example, nowadays the COVID cases are rising. So what was the COVID variant? So recently, so because that was the question, that can be the question asked. So you should also be updated regarding the current health related or the PSM related updates. And forensic also have 4 questions. pathology have 5 questions, physiology 5 questions, okay, and anatomy 5 questions, and OBG, obstetrics and gynecology included 8 questions, and then surgery 8 questions. Okay, so sometimes what happens, pathology, physiology, it can be an integrated question which is asked with respect to the practice of medicine as well. Say for example, if they ask what is the lifespan of RBC, so it is actually a physiology question. Okay, but you also study practice of medicine in the practice of medicine part as well in the hematology. Okay, so we'll move on to the pattern of questions. Okay, so now we are very clear about the subjects and also their marks weightage. So now you should be preparing accordingly. And what are the pattern of questions? So before when the AIPGT started in the initial years 2020, 2017-18, so the questions were all direct question. Okay, like direct one-liner kind of question where they used to ask. They used to ask the question and similar option will be there where you can easily option. So nowadays the question pattern is evolving. Okay, right from 2020 AIPGT, the question pattern is evolving. So you have this one-liner kind of question. Okay, so one-liner or direct question. Say for example, who is the father of homeopathy in America? So the answer is Harry. So if you know the option, if you know the answer directly without seeing the option, you can answer. So these are called as one-liner and direct option question. So next there is a statement-based question. So they will be giving two statements. So okay, so it can be related to the statement one or it may not be related to the statement one. So there will be two statements given. So under that they will be telling so whether which statement is correct, which is wrong. Okay, statement one is true, statement two is false. Both statements are true, both statements are false. So such kind of questions you will be having. Okay, for this you need a factual knowledge as well as the conceptual knowledge. Okay, and then they match the following. So this is the most important thing. So they say for example in materia medica they might give 4 symptoms on side A and they will be asking the 4 remedies on side B. So you should be matching those match the following kind of questions. Okay, so that is more important. So now I would say match the following, be it any damn subjects, please attend, because you can eliminate, at least if you know the one option, you can eliminate the particular options. Okay, say for example in the 4 option you know that option D. Okay, in the option for in the side A D, in the side B you have option 1 is the correct answer. So in the option you can check D1 which is the option, then you can try to rule out. So match the following any damn subject, please attend, because you can try to eliminate the questions very easily. And then you also assertion reasoning question. So this is the, there comes the conceptual, and this matters a lot with respect to a good rank holder in AIPGT and the average rank holder. So what happens exactly is, for assertion and reasoning you should have the subject knowledge in depth. Okay, in depth subject knowledge has to be there. Okay, so if you try to rule out one or the two options, please go for it. Sometime what happened, you might happen to get a question which is very similar, but you're not having a very deeper understanding of the question. So that is what you call it as assertion reasoning type of question. So this is very important, and there are multiple answer kind of question. So that means, so there can be a symptom given and there will be 4 remedies, and out of 4 remedies there will be 3 remedies which is covering that symptom. Okay, in the option there will be ABC only, BD only. Okay, ABD only, like that kind of option will be there. And the recent trend of asking the case scenario question. Okay, so there was a question in surgery which was asked based on the case scenario. A patient aged 50 years, 60 years has come to your OPD with perrectal bleeding, and the bleeding is it's a very bright red hemorrhage, so it's an arterial bleeding. Okay, the options were cancer rectum, hemorrhoids, okay, fistula, fissure. So this kind of question was asked. So this is a case based question where the patient presented with OPD, okay, with particular symptom. Now it's a kind of diagnosis kind of question. Okay, this was asked in one of the AIPGT in surgery. So how do you differentiate? So in the case scenario, see, the first thing is that is age given. Okay, so age 50 plus years. Okay, so which is high risk for cancer rectum, and there is there is a very active bleeding, so that is arterial bleeding. Usually in hemorrhoids what happened, it is because of the engorgement of the veins, and usually it is associated with the stools also, before stool, and while the patient is passing the stool there is bleeding. Okay, and this is a arterial bleeding, it's a very constant bleeding, and also there is history of weight loss. So like this you have to try to rule out, and then you have to answer. For this this is the new trend nowadays asked in AIPGT, that is the case scenario based question. Okay, and for homeopathy subjects, see, there are n number of resources out there in the market available, but for me what I believe is, because there are hardly 30 days remaining for your examination. Okay, now that you can't cover everything, so there is a, for homeopathic subjects, always stick to one book. I would always say stick to one book than multiple resources. So end of the by the time you are on the last day of the examination, you will be having majority of the resources, but there is no constricted or a very narrow approach for the examination where you can revise everything. Okay, so I would say you can revise one book 10 times, that is more better than comparatively to studying all the 10 books once. Okay, one book 10 times you should revise. Okay, that would be a better strategy. You have a book called as Success, so in under that there are 3 volumes, but I would suggest volume 1. Okay, so this contains all the homeopathy subjects. One book is enough for all the homeopathic subjects. Of course, there are mistakes and they have been revising it accordingly, but a majority of the information is correct. So book recommendation, Success, you can go. And also you have Turning Point. It is by Dr. Alok Mishra and Praveen Kumar Kesarwani. That one of the oldest book of AIPGT and even UPSC. And you also have many UPSC examination question paper in the end. Okay, so that you can study at least for the 30 days. And if you are studying for 1 year, you can, along with this book, you can add other book also. You have Crack the Entrance, there is a book. Okay, and also there is a VK Chauhan's sir's books. Okay, all those things you can add, but these are the basic recommendation. And then for organon of medicine, as I told, organon of medicine is a highly scoring. So in the Success book, as I told, all the 4 subject is covered. But at the same time, the organon of medicine, you should also actually go through the text. Okay, especially if you're studying for 1 year, you can go through the text, both 5th edition as well as the 6th edition. Okay, it's very important. And what are the questions asked in organon? Because I told organon you can cover in very short period of time, and at the same time the questions are highly yielding. Okay, the one thing, the most commonly asked question, because anyway organon there is only aphorisms, the questions asked are always aphorism based question. Please make a note of it. Aphorisms are the one which are very important. Okay, at least you should have an idea. Okay, case taking, it is from 83 to 104. Drug proving aphorisms. Okay, so and also the general aphorism, which is the theoretical part, and in what is mentioned in which aphorism. At least now you have 30 days, at least the gist of the aphorism, if you are knowing, you can able to score very good marks. And one more important aspect is Kent's observation in organon. Kent's observation 100%, because it's a strategy. Every year I saw a post from Homeo Elite where they have combined the Kent's observation. Every year one observation is asked, whether they might have asked the result of the observation, or they might give a case scenario based of question where you have given the remedy, the patient symptoms got aggravated and then it got better. Okay, so and the patient got cured. So what is the observation? What is the number of observations? So there are 12 observations. You can study less than half an hour. All the observation, one question is for sure every year, right from 2017 to 2020. For every year one question is asked. It can be asked in a twist and twirl manner, but the question remains same. Okay, and then the most important thing is miasm also. One question from miasm you can expect. Usually what they ask is patient is aggravated, they give some symptom, patient is aggravated at night, so this symptom belongs to which miasm, whether it is sora, whether it is psychosis, or whether it is syphilis. Okay, usually they ask these 3 basic miasms, sometimes tubercular also. Okay, so these are the questions, these are the high yield areas for organon of medicine. Okay, and then moving on to the materia medica, though I am faculty of Homeo Elite in the materia medica subject, it's a very vast subject. Okay, so there is nothing to choose and study. You should know how to, these are the 2 fundamental books. Okay, out of 16 questions from materia medica, you will be getting 10 to 12 questions from Allen's as well as Boric. So if you see, there are large number of remedies. You have 740 remedies in Borix Metra Medica, and even in the Allen's keynote it is 180 remedies. Allen's keynote, each and every symptom you should be knowing. But also there are one thing I would say is read all the no sorts from Allen's keynote, because every year one question from no sort is always asked. So read all the no sorts from Allen's keynote. So this is very important, and 1 or 2 question can be asked from Nash also. So that is therapeutics Nash. Okay, EB Nash, and then there can be also question asked from the Kent. Now that you have only 30 days time and there is only one question asked on that particular aspect. Okay, so now you can't study everything. For one question, you can't study entire Kent's materia medica. Okay, so what I would say, you can see some high yield questions, then you can study, but prefer more on Allen's keynote and Boric. Read every day. Okay, so this is the main strategy. Every day you have to read, and by the end of 1 week you should recall every symptoms you have studied. So this is the only strategy. Okay, anybody who mastered Allen's keynote, okay, so Calcutta practitioners use Allen's keynote very frequently. Okay, so even though they have mastered Allen's keynote, so what exactly happens is each and every line you should be knowing. Okay, so that is why at least you try to read no sorts, all the no sorts from Allen's keynote, because there is one no-sod question every year, right from 2017, and that's a very important thing. And one more thing, you also go to previous year questions from Materia Medica. So there is a chance that you can get the same questions. Okay. And then moving on to the repertory. Okay, so repertory, the one reference which you already studied in your no UG is Essentials of Repertorization by Shashikant Tiwari sir. So majority of the time, the factual based information, this book is enough. And also the three basic repertories, that is BTPB, BBCR, and Kent repertory. From these repertories, you will be having questions from rubric hunting. Okay, they will give a rubric and they will ask you which chapter in Kent repertory has this particular rubric. Okay, so and also sometimes there can be a very tricky question. They can ask a single drug remedy rubric. So they can, what is the only remedy mentioned in under this? But say for example, in mind chapter of Kent repertory, what is the only remedy mentioned in Kent's repertory for the rubric benevolence? Okay, there is only one remedy. So like that, you can single drug rubrics they can ask you. Okay, so there was a question in previous year where they asked that. No, the remedy for yellow dandruff in Kent's repertory. There is only one remedy, so you can't refer entire Kent repertory, and you only have 30 days. So you should know the high yield question. So that is why it is very important. And then you can in the BBC sometime there can be a combined repertory question. Say for example, BTPB and BBCR. Which of the following rubric is seen in BTPB, not seen in BBCR? Okay. For that you should have a in-depth knowledge. So only majority who have studied very thoroughly can answer such kind of questions. Okay. And pharmacy, as you say, mandal and mandal. And one more important thing, if you are already referring some books for a very long time, please stick to that. Please don't listen to my strategies. Please don't change the book just because it suggested some book. So it is not a thing. Whatever I am suggesting is kind of standard textbooks of the subjects. Mandal and mandal, 12 question. Anyway, the areas are very easy. Vehicles, question can be asked from vehicles, pharmacopoeia. Okay, these are the areas where the questions are asked. And then you also practice of medicine. Practice of medicine, if you're already referring some book, you can refer. But there is a book called as Mudit Khanna. It's a very ideal book. Okay, if you're studying for one long year, you can know, because there are many revisions happening, and it is more standard kind of book for practice of medicine. And if you're already into any other coaching platforms, you can refer their books also. Okay, it's nothing like you should not refer. You can refer any platform books. Okay, but let it be little standard, and let it be it should be ideal for you as well. Okay, and then for OBG. Okay, so you have this one of the best books. Even the NEET PG aspirants after MBBS they refer this book. So this is by Dr. Sakshi Arora Hans. It is called as self assessment of review and obstetrics. So where there are very easy kind of MCQ kind of question. So she is also faculty in Marrow, one of the medical platform. Okay, so and then the standard books what you're referring is DC Datta. So this you can refer. And in the OBG obstetrics, the high yield points are the labor. Okay, the stages of labor, if there are any signs of labor, and the changes during pregnancy. Okay, these are the common things you can ask. Usually they will not ask any question regarding LSCS, or you are not becoming an obstetrician tomorrow. Okay, but you should have the fundamental knowledge of the OBG. So that is tested in the APGT examination. And then you also have PSM. If you are studying for 1 year, you can refer this book by Dr. Vivek Jain. Again, he is one of the faculty in the platform. So he is a very MBBS doctor, expert in preventive and social medicine. This book you can refer. Also any guides for that matter, giving adequate information of the PSM. In the PSM, the high yield questions are the especially the plans, the program, national programs, whether it is RNTCP, polio and AIDS control program. All those programs are asked, and also the vectors sometimes. Vector, which disease causes, which vector causes which disease, and also the studies. You have a chapter on studies, the cohort study, case control study. That is also one of the high yield area for PSM. Okay, and then comes the minor subjects. So say, because minor subjects, once you complete the major subject, please start with minor subjects. Okay, because there are less number of questions, and see, now you should be having an idea that in the less number of time you should extract the maximum information. It can be from wherever, okay, in whichever sources, but you have to extract the maximum information. So you have anatomy, you have physiology, you have FMT, and pathology. So hardly 4 to 5 questions are asked from each subject. Okay, so some of the high yield you can see, you study upper limb first, especially in the upper limb, cubital fossa, the arteries especially, okay, nerves, okay, and also if there are any structures, say for example, if there is a femoral triangle, okay, if there is cubital fossa, structures passing through it, if there are triangles of the neck, such kind of important high yield questions you can study. Physiology, the basic thing, at least once you have to glance it. FMT again, it's a very important and it is very scoring also, especially the post-mortem changes in forensic medicine. So in that the questions are asked, what is algar mortis, rigor mortis? Okay, all those things you should be knowing. Okay, so and then you also have toxicology, only one question. Usually there is only one question asked. There can be from some poisoning or there can be some confirmatory sign, which is the most common cause of this particular death. Okay, which is the most common poison which causes this. Okay, such kind of questions can be asked. And pathology, some directly some questions can be asked. And also, especially if you're studying pathology, start with inflammation. So inflammation, the stages of inflammation, what exactly happens, what are the reaction, what are the cells that comes up. And also sometimes systemic, whatever there are, if say, there are some gold standard signs or there are gold standard findings in pathology, then you can refer that. So for all these things, you can refer a book called as Rome's. Okay, it's beautifully given. For at least for minor books, if you're studying for next year 2026, you can refer this particular book. Okay, and the most important thing is the mock test series. Why? Because BD Jati Homeopathic Medical College, they are giving you three free mock tests which are very high yield. Okay, so it is very important to attend free mock tests. Okay, why it is important? Because you are not used to the exam pattern. Tomorrow, this is a computer based test. Okay, when you sit in front of your system or sit in front of your computer, what exactly happens is you will go blank. Okay, if you're not attending mock test series, if you're only studying and appearing for the examination, you have no idea how the examination will be conducted, how the screen appears. And then on the day of examination, you will be searching the screen. Okay, so that is the very wrong strategy and wrong idea of approaching the examination. So usually there will be screens like this. Say for example, this I have taken from the NTA, National Testing Agency. So here you can see not visited. So there is 74th question. The student has not visited. Okay, so you can see there is not answered. Whenever in the not answered column, okay, you will be having one. Okay, that means not answer will be in the red color, answered will be in the green color. And one more important aspect, there is also a option called as answer and marked for review. Say for example, there is a question, you have confusion between option C and option D. Now that you have no time, because 120 question, 120 minutes. So that is how the examination is scheduled. And then now what exactly happens is, so you can answer between option C and D. So you feel C might be correct. Okay, you're not very sure. You feel that C might be correct. Okay, but you need to understand once again, think once again, and then answer. What you do, you can answer, mark it as C. Okay, and then you can give an option. So here you can see there is no zero in the blue color. There is zero in the blue along with green. This is what you call it as answered and marked for review. Okay, so why it is very important? Okay, so if at all if you submit the questions directly, so the C will be opted as the considered as the correct answer. Okay. If not, if you review and then again you change it to D, okay, then it will be confirmed. Or you just want to see the question once again, you can just mark it as marked for review. So this is the real-time AIPGT screen interface. And you also have many mock test series which are available for very affordable prices. This Home Elite is also giving 30 online tests, okay, just 99 rupees. So again, 30 days are left, you can attend 30 questions which are very high yield, structured by experts, subject experts. Okay, and one more important aspect is it's a computer based test and real-time AIPGT screen interface. Okay, so that's very important. Okay, and 120 questions, and you also have 120 minutes. And there in the BD Jati Homeopathic College, they are giving free mock tests. Please attend all the 3 mock tests because it's very important. They are all crafted by the experts, okay, by the professors and by the PG students of BD Jati Homeopathy Medical College. So this is very important. You have to because you get to know who are your competitors, how are they performing, and where are you standing in the examination. Okay, and then the most important thing, I try to categorize this examination into the category of students into 3 categories. One is long time, other one is the interns who are preparing or students or the doctors who are working and preparing for past 6 months, and then who are just new to AIPGT. Out of the box, you have decided that you have to write PG examination, and hardly from today there are 30 days left. Okay, so these are the students which are very important. And as far as my experience since past 4 years is concerned, so I have seen students who have not obviously who have studied from very one long year, they have definitely scored a very good marks in the examination. And that doesn't, and we have also seen students who have studied for last 1 month, and also students who prepared in between without much consistency. Okay, they have also scored much better marks if you know the approach to the examination, if you know the strategies for the examination. Okay, so now I'll be giving few tips for the long term students. That means that they are who are already studying from 1 year, who are very serious about AIPGT. So first thing I would say is stick to your routine. Whatever you are doing it right. Okay, because you are studying regularly, you know the subject weightage. By now you know the subjects, you know the high yield points. You are already on the track. Okay, please continue the same thing. Please don't change. Please don't listen to my strategies. Okay, so I am just telling these are the high yield questions. Okay, but whatever works for you, please continue. Please don't listen to me. And one more thing, and trust the process and what you are doing. Okay, see, because you are already on track. You know, material medical are studying daily. Organ you already completed. Repertory already completed. You know this. What are the kind of questions that can be asked? Okay, so this you have to trust the process. Sometimes there can be anxieties. Sometimes you might feel low confidence, but definitely you have to trust the process. You are doing well comparatively. Majority of the students are not started, but you are doing well. You're on track. Please continue the same thing. And most important thing, as I told, no, because 30 days, please don't be overconfident. Okay, please attend all the mock tests. Okay, and also do multiple revision. Revision is the key for all three set of students, whether it is long term or you're studied today or tomorrow. Revision is the game changer thing in the AIPGT examination. Student who have done multiple revision over a period of time. Speaking to many toppers, we know that no, it's a very clear thing. Doing revision will definitely help you in the long term for the examination. Please make a note of it. Revision is the key. Okay, even if you study one topic, it is enough. High yield topic, if you study, revise the same topic again and again. Okay, so that is more important. And for long term, you're already on track. Attend some mock tests. Okay, so do some multiple revision as far as possible. So I'm very sure that rank one student, he already knows what he has to be doing, and he knows that already is on the track because he's scoring well in the mock test. Okay, so that is very important. Okay, so then moving on to the this major part. Okay, major part of my doctors here are who have completed their internship, and you are who are also interns because you are eligible till the July 30th, I guess. So till the completion of your internship, you can eligible if you are inside that date. Okay, and this for them the strategy is. See, now you don't have the most important thing is, so you don't have a luxury of time to build mansions of knowledge. So now you can't become an expert in anatomy, and you can't become an expert in physiology, or can't become an expert in materia medica, which is again 700 drugs in boric, 180 drugs in alliance. It is not at all possible. Okay, so now you don't have luxury of time. It's hardly 30 days to build the mansions of knowledge and information. Now there is no point in accumulating too much of information and then no reciprocating in the exam. Say for example, if you studied entire physiology, or if you studied entire pathology. Okay, so but only 5 questions are asked. What is the point in studying the entire subject? Okay, so you should know the high yield points, then you can understand. So what you have to do is you have to fish in the right direction. That means you should gather right information. So I try to put an image here where the person is studying in the random. Simply randomly you are taking some topics from materia medica, reading 5 drugs from boric, or 10 drugs from Alensky, mastering one BTPB repertory or mastering Kent repertory. It is not at all useful because the question is asked from everywhere. And what you have to know is you should have the high yield points you should find. Okay, the most important high yield points. So you can see, because if you are not studying properly in these last 30 days, it matters a lot. Okay, it can make a drastic difference. So you should try to change your approach, change your direction, and fish on the right side, or or study from the right direction where the question is asked. So this is the most important thing for AIPGT. So students have cracked in a very less time. Like I have many friends who were in my batch. They were appearing for the next AIPGT, who didn't give their first attempt, or maybe because of some reason, unfortunate thing, they have not qualified, or they didn't get a desirable seat in their first attempt. They have started no, in the second attempt they have given. But whereas I also seen even in the first attempt there are students who studied for one month and they have got a very good ranking as well. Okay, so you have to change the approach. So for them there are a few strategies, because you don't have much time. In the limited time you should make it best of the outcomes. Okay, the first thing is you have to do smart work. There is no other way. You have to do smart work. Some important topics I have told while dealing the individual subjects. Okay, please study those first. It will be definitely helpful. And the high yield areas, every year high yield areas. Where do you get high yield areas? You will definitely get high yield areas by seeing the previous, because there is no curriculum as such. So for the only curriculum for AIPGT examination is all the BHMS subjects, but there is subject weightage. Okay, but whatever the type of question you are asked, at least you will get to know by high yield areas by doing the previous year questions. Okay, by doing previous year questions, you will get to know many high yield areas. As I told, no, Kent's observation is one of the high yield area from organon of medicine. Allen's keynotes, notes, whether it is tuberculinum, syphilinum, medorinum, sorinum. You see, go to previous year question papers and watch, see the question. So definitely there is one question. Okay, that becomes a high yield area. So it's not that the same question might be repeated from medorinum or the same question might be repeated from sorinum. The basic idea is, so you will definitely get a question from medorinum. Okay, like that. So you definitely get a no sort from that particular remedy. Okay, so then if you have any rapid revision courses, you please attend that, because in majority of the subject experts, it's not just that in homeoelite, or just because I'm faculty in homeoelite I'm suggesting homeoelite. It's nothing like that. So any rapid revision courses, you might sit with your PG students. Okay, in BD Jatti Homeopathic Medical College there are many PG students. We have Dr. Naveen there, and no, who was my junior, and there are many other doctors, okay, in the PG students. And you can also speak to your HODs and even the professors and also the principals of the colleges. So they ask them what are the high yield, because they have some experience teaching lot of like 15-20 years the same subject. They have some experience, and no, majority of the time it is from the subject experts who are framing the questions. Okay, take their inputs, see what best can be done. What are the high yield areas in the question, then you can start studying. And one more important is strategies with bullet points is very important. Okay, so because on the day of the examination you will be left with, okay, you will be left with literally 15 to 16 subjects, which a normal human cannot revise everything. Okay, and on the day of the examination we have seen many faculties have seen receiving calls that no, I'm not able to study, I'm feeling underconfident, anxiety, student who have anticipation anxiety, on the day of examination, all these things. You feel that everything whatever you studied will forget. So that is quite common, it happens. What matters most is how calmly you are approaching. Okay, so now most important thing, because this is a 30-day strategy, I would say, what is more important, one is the do grand test, do MCQs. Especially when I say grand test, it is completely 120 marks question. Okay, 120 marks, 120 questions, which total marks is 480. So that is very important. And examiner's empathy, so that there are no questions which are examiner's favorite. Okay, so those questions you have to prepare, those areas you have to prepare. Say for example, in organon you can't ask the question should have to be from the aphorism. You can't ask there can be one or two questions from other philosophies like Kent or H. Robert, but the majority of the question has to be from aphorisms. Okay, because if there, that is the only area of question where there is only option left for the examiner to frame question. Okay, so that you need to understand. And then revision is the must for any category of student, whether you are long term studying from 1 year or you are studying for very short time. Revision is the most important thing for AIPGT examination. Okay, do multiple revision. See, what you do is once you complete the subject 3 days, 4 days, what you do, you revise the subject same thing. Okay, what you can do is, you have 30 days left, 5 days you read, so 1 day revision. Okay, and one more important aspect is a previous year question. Okay, very important, previous year questions are very important. You have literally 2017 to 2024, so literally you have some 6-7 years of previous year question, because you are now you want to crack it in very short time or 1 month of time. Each and every question from the previous year you have to be knowing. Okay, you have to be knowing. So because say for example in OBG, okay, so there is a question on placenta every year. Okay, so that placenta is a high yield question. How did I get to know that there was a question on placenta every year? Okay, or it can be any abnormalities of placenta, placenta accreta, okay, placenta discreta. Okay, so it can be anything, abruptio placenta, okay, placenta previa, anything. So because these are the areas, how did I get to know it's an high yield topic? Because I have seen the previous year questions. Okay, so in the previous year question everywhere there is placenta. So now placenta is one of the high yield area. It's not that I'm telling in the AIPGT 2025 there will be a definite question on placenta, but this is the examiner's favorite. And one more important thing is, nearly 5 to 10 questions will be repeated from previous year questions. Okay, so there is a tendency, because organon you usually see repeated of question, materia medica there is repetition of the question, so that is very important. And then the most important thing is it's always the matter of the few correct MCQs. Okay, say for example, if there is a very easiest MCQ, please attend it. Okay, please attend it, give a shot, don't make mistakes in easiest question. That is what make a gradual difference. Okay, so because what happens exactly is, it's always the matter of question. See, one question if you make wrong, you are are getting behind of your rank. Okay, 5 marks is getting behind because you already lost 4 marks by not attending no, that question, and you also have one negative mark, so 5 marks is gone there. Okay, student who have not studied for a very long time, even they studied for short time, may beat a student who has studied for a long time as well. Okay, so this is how the game, so this gamifies the entire AIPGT. And one important aspect is don't attend all 120 questions. See, provided if you are a repeater and you have very vast experience in AIPGT, of course you have to be aggressive. So that doesn't mean so Dr. Kiran has told not to attempt 120 questions. So I'll just attend 40 questions and come back. So please don't do that. See, I am telling you how to be aggressive in the examination. Definitely you have to be aggressive in the examination. But you see the set of questions or the difficulty level. So 50% question will be little easy kind of question, and rest 30% will be a little average kind of question. Who have studied, has in-depth knowledge of the subject, and then you can score that. And the rest 20 questions or 10 to 15 questions is set in a frame that nobody should answer. Even a student who has thoroughly studied the subject, nobody should answer. That is why in nowhere in the history of AIPGT, no student has scored 480 out of 480. Okay, the highest score might be somewhere 300 to 350, and depends on year by year based on the difficulty of the paper. So the idea I am giving is nobody has scored 480. Okay, please don't attend all the questions. If you are very aggressive, you are very you have attended hundreds of grand tests, then you can attend it. I'm telling you have to be a bit aggressive. And recently I was one of the topper, I asked a question that what is the ideal number of questions that can be asked, okay, that can be attended on the AIPGT. Who decides it? Actually, the number of questions on that particular day, it is decided by the student itself. Okay, if you are attending 20-30 mock tests, you will get to know that this is the paper which is easy, or this is the paper which has average difficulty, or this is the difficulty of all the examination. All the AIPGT is the most difficult examination. There you can adjust your questions. Okay, if it is easy, you can attend. So the ideal thing I would say is somewhere around 80 to 100. Sometimes you are taking more risk, 105. See, because what happens if you attend 120 questions, 70 if you are attending correct, and if there are 50 wrong if you are attending all the questions, so you are 70 question you have scored good marks, positive marks, and you are getting 50 negative marks, so which will bring down your grades, which will bring down your ranks gradually. Okay, and revise the fact. There are factual questions, especially in repertory, the years of publication, who is the author, which year it was published, how many gradations are there. These are all factual questions. Okay, tomorrow you might not take up repertory in your MD, or you might not take up materia medica, or you might not take up practice of medicine. You are more into homeopathic subjects. But thing is, for cracking this examination, this is the basic knowledge you require for entire thing. Okay, please focus on these things. Revision is the must for whoever it is. Okay, revision is the most important thing. Okay, and how do you strategize for the next 30 days? So this is the most important thing. What matters most is what you do today is counting. What you do is today is actually counting. Okay, so this session is only 1% no inspiration for you, and the 99% is now what you do hard work that matters a lot. Try to cover high yield areas, as I told, because 30 days remaining. Try to cover high yield areas. And one more important is do previous year questions. Start with 2024. At least if you're having less time to study every day, what you do 2024, 23, 22, 21, go in a retrospective manner. 24 to 20 you can see, because the exam pattern has changed. Because before in 2017 it was 100 marks questions, now it is 120, right from 2020 AIPGT. 2020 to 2024 you have 120 marks, 120 question examination. So you have nearly 480 questions there. Okay, so you'll get to know what are the high yield areas as well, and more focus on homeopathic subjects. 4 subjects will cover 60 questions than studying the rest 30 subjects. I'm not telling that you should not study the rest other subjects, but these are the more important of organon, pharmacy, materia medica, and also the repertory. This is very important. Focus more on homeopathic subjects. Study as I don't because I see many students who study well not attend grand test, and there are students who attend only grand test. They will not study, they will only attend grand test. If they are getting good marks, okay, I am getting this. See, grand test is not for studying, or it is not for where you stand in the examination. Grand test is, if you are, say for example, BD Jati Homeopathic College is offering you 3 free mock tests. So in these 3 free mock tests is not just for your examination. It is not to see who is your competitor. Not see, what you are doing is, in these 3 mock tests you see, you do all the mistakes, that is possible, and you see what are the number of questions that can be attempted in the examination, so that you are overcoming your peers. Okay, please, whatever mistakes are there, you do in this mock test. Okay, on the day of the examination, you should be the king, you should be the leader. Okay, you have to crack the examination, I should be a champion. So that is the basic idea. So there are students, in the first mock test who has scored less than 100, might score after, after 1 or 2 3 mock tests, they might score in the third mock test 220 220 or 250 plus as well. 250 plus is a very good score. Okay, so this is how you have to understand. Okay, please study, along with that you do the grand test as well. Okay, and also be smart, be very smart. Okay, you know this is a very difficult question, so be very smart, and then be confident. Confidence is the one which is very important, because at least you have studied something. Okay, so this is very important, because there are 9,000 plus students attending AIPGT this year. Okay, so that becomes a very important aspect, and hardly 1,000 to 2,000 will be studying very hard. Okay, so if you are focusing these 30 days, you are already into the league. Okay, so that's very important. And the number of questions, as I already told you, how much to attend. Okay, that's a basic idea. So you decide based on your mock test experiences. You are the only person, because I don't know, like what exactly, whether you're trying for rank 1, or whether you're trying for, you just need to qualify, or whether you're trying for a rank just below 100, 500. So it depends on your appetite, your risk, on how much you attend the question. Okay, so this is the pattern, as I already told. So if you really want to know how the real-time mock test will be there, so you can, in the home highlight also, that's a real-time AIPGT interface, and also in the NTA YouTube channel, there is a, how to answer the question, there is a video. Okay, so might be I might share the link later, so that in the NTA, so what is the real-time examination, how the questions will be there, you will get to know. Okay, and the MCQ solving, as I told, one more important aspect where majority of the student fails is, okay, in attempting the MCQ. So if you are able to eliminate one option, there is a question, if you are able to eliminate out of 3 options, if you are able to eliminate one particular option, so what exactly happens is, the answer, the correction of the attempt of correcting the answer will be 33%. Okay, so you are very sure that option D is not the correct answer, you will be left with 3 options. In the 3 options, the probability of getting the answer correct is 33%. Okay, so these are the questions where you need to take risk. And one more very very important, this is the game changer for majority of the students. If you are able to eliminate 2 options, that is, say for example, A and D are not the option, so you are very sure either it is B option, or whether it is C option. Okay, so in these 2 questions, these 2 options, you will be left it out. Okay, so now the probability of getting correct answer is 50%. Okay, that means if if you attend that question, if it is wrong, you will only lose 1 mark. If you get it correct, and if you get it correct, you will be getting 4 complete marks. Okay, so in whenever you have option doubt between 2 options, okay, so you have to take risk and you have to attempt. Okay, so in 3 options, there are probabilities very less of getting correct, but 2 options, try to rule out 1 option, and you please please attempt those kind of questions, and match the following irrespective of any subject. If you are, because in the match the following, easily you can rule out 2. There will be only 2 confusing option in the match the following. So in the match the following question, please attempt whatever is possible. Give it to your best. Please, even if you don't know, if the answer is from biochemistry, you are able to rule out 2 options. So you know that in one match the following, it is correct. Okay, you don't know the rest 3, but in the option, if you see, you can able to rule out 2 options. Please attend that kind of question. Okay, and also the set of questions. Okay, you can categorize the examination into 3. Okay, 3 pattern, like 120 questions. So first you answer whatever you know, easiest question, direct one-liner question, this is the answer. Yeah, so the moment you see the question, you know the answer in the mind before seeing the option, but read the question very thoroughly, because sometimes what happens, which of the following is not a remedy for that particular symptom can be there. Not A is a very important. So you see the symptom, you answer. So please don't be in a hurry, please take time. So in the first hour, what you do is, whatever you know, you attend, try attending, and whichever question requires some concept or knowledge, or it takes little time, I'm not able to recall whether it is 1831 or 32. So those kind of questions, you do it in the second round. And in the third round, the only thing what you have to do is, okay, in the first round you are attending whatever you know. Second round, see, once you attend, it's not 120 question in the first round you're attending, it's hardly some 50 to 60 questions. And then again in the second round, whatever you feel, you know it, but you're confusing whether it is option A, B, C, then those kind of question you can attend. In the third round, you're not attending. So in the third round, you're not attending any question. Thing is that, so third round, the third set of questions, maybe that 10 to 15 questions are set by the examiner, so that no student should attend. Okay, if you're attending that, it definitely a short question which will get wrong. Okay, please don't attend. You know that, no, because the moment you see the question, you will realize whether this particular question is from medicine or whether it is from pathology or not studied about biochemistry. There is some interrelated questions, so which require too much of knowledge, and you must require too much of expertise to answer that question. Such kind of question, you please leave that. The 10 to 15 question you can leave like that only, because nobody can answer that, because because you know that even a topper cannot answer that question. So that is because no topper has scored 480. It is as simple as that. Okay, so no topper has scored entire marks in that particular examination. Okay, and one question I'll try to do. So here you can see a question from Materia Medica. Balm of Gilead is a common name of. Okay, so these are the four options. You have conium, you have cocculus, you have podophyllum, you have populus canadensis. Okay, so if the chat box is open, okay, is the chat box is open? Okay, so what are so can the participants answer this? What are the options? What is the answer? Okay. So Dr. Ahmad has answered. So option D. Okay. So many have answered option D. So populous, few students have answered populous. Okay. So there are students answering conium. Okay. So option A. Okay. So here you can see. So okay, what exactly happens? One second. You're able to see the screen? Okay, so here you can see there is a very minor difference. Okay, so this is how the MCQs usually tend to appear. Okay, so this is how the usually MCQs tend to appear, because this is how the options are. Okay, so the answer here is, so please make the question because that's why the presence of mind is very important. So balm of Gilead is the common name of which remedy? So here you can see in the next slide. Okay. Able to see the screen? Yeah. So the answer is balm of Gilead is a common name of populus canadensis, whereas balm of Gilead for diseases of the old maid. So this the answer is conium. Okay. So there can be confusing questions like this also. So that is very important for your AIPGT examination. And the last 5 days, how you need to prepare. Okay. So the last 5 days, read the forgettable information, especially years, the number of aphorisms, whichever information you know, please don't study that. Whatever forgettable information is there, you can study those information and read all homeopathic subject. Last 3 to 5 days, it's only homeopathic subjects and the allied, whatever difficult part is there, you can read, and don't read anything new. See, because there is no space for in your brain to accumulate more information. Okay, please don't read anything new. And last moment notes or any rapid revision courses if you have enrolled, so that will be definitely helpful. And remaining calm and composed is the key. Okay, very important. Remaining calm and composed is the key for cracking AIPGT. Don't be anxious, everybody will forget. It is quite common that, because human tendency is to forget. Okay, so that's okay, but at that time, on the day of examination, you should be little calm and composed. Have adequate food day before examination. Okay, so don't don't do overnight study on the day before examination. Okay, your mind should be very much alert on the day of the examination. So this is what is important. And if you're having any 3 to 5 days last moment revision, you already have a strategy, and you know that I need to study because I'm weak in this subject, so you can study accordingly. So this is a general idea, majority of the toppers do. Okay, and you also have in the Homeo Elite, they offer a crash course also for 30 days, where they also included 30 online test series as well, so that you can, if you're interested, you can enroll. So you can see success doesn't come from what you do occasionally, but it comes from what you do consistently. Okay, so the consistency is the key. You have 30 days left. Okay, so 30 days, no, every day it's 24 hour. So it how much hour you invest in your study is up to you, and make it big, because you still have time. You're not late, because I've seen many students who have cracked examination in the last 30 days, okay, by studying. And if you are failing to prepare, you are preparing to fail. So don't listen to no random things. So this can be a question come. So please don't listen to this. Focus on what you're doing. You're already doing it right. You know now you know the subjects, you know the high yield areas, you have done the mock test. You can be very confident on the day of the examination. And revision truly is the key, which can be used to unlock the doors. Okay, so and for the doors, you can unlock the door of AIPGT and get into MD homeopathy as far as your desirable subject and desirable colleges. Okay, this is a very important aspect. Revision is the key. Revise daily. Okay, whatever you have studied, you revise. Okay, so that becomes the most important thing. So this was the agenda of today's session. At the end of the session, so this was the agenda. Like you got to know the importance of MD homeopathy, understand the AIPGT exam pattern, and enumerate the subject-wise marks weightage of examination. Okay, and also I would like to thank BD Jati Homeopathic Medical College for the opportunity. Okay, so I would like to thank Dr. Anand Hosur sir, Principal BDJ HMC, and also HODs of all the department. Okay, so who have been put their relentless effort to do such orientation. So because I've seen many participants from different parts of the country listening to this orientation. So this becomes, as a part of the college, it becomes a very responsible thing. And it's a very nice college, one of the oldest college we can say in homeopathy in Karnataka. So in 2022, because it's from 2003, 3 or 4, I'm not very sure. Since then, there is a PG, a PG course happening in BD Jati Homeopathy Medical College. You can get admission to BD Jati Homeopathy Medical College also. And also I like to thank Homeo Elite team for the opportunity, because being a faculty, they have given me opportunity. And also the major role is JIGNASA Karnataka team. Okay, so they are enhancing the AYUSH opportunities, and also they are promoting students and doctors to practice AYUSH. Okay, and if there are any question, I can take up. And thank you all for your patience listening. Hope this session will be very helpful, and I wish you all the best for AIPGT examination. Okay. Is there any questions?
Thank you, Dr. Kiran Kumar, for giving the valuable information and tips regarding AIPGT. And I hope many of
Thank you.
them
Thank
have
you.
many of them have benefited. Last 3 days are left to fill the AIPGT form. So I request participants to ask any queries regarding entrance exam, regarding the form filling.
Yeah, I think already form filling has started. Okay, so if you have made any mistake, there will be a correction window open. See, because always rely on the adequate or the concerned gold standard website, that is NTA. Okay, so National Testing Agency is the exam, is the website. Okay, where you should fill the AIPGT, because you also, before filling the AIPGT form, what you have to do is please read the brochure once. Okay, what has to be filled, and what exactly year of completion, all those things you should be very aware. And if you are no July 30, I think some date is been given specifically. If you have completed the internship before that, you can attempt this year's AIPGT. Those who are still interns, who are completing in August, September, October, they can't attend this year's AIPGT. They can prepare for next year, and AIPGT will be happening once in a year.
Anyone is having any queries?
You can type in the chat box as well if you are.
Yeah, you can type in the chat box.
What would be the Dr. Harika is asking what would be the rank to get government seat. So I think it depends on the cutoff every year. So in Karnataka, at least you should be having a rank less than 300. So in exam, once it is attempted and submitted, we can't come back and recorrect it, sir, if it is in doubt. See what happens, as I already told you, see, this is a 2-hour examination. Even if you're not submitting the test or the exam, by the end of 2 hours, it is auto submitted. Whatever you attempted, that will be auto submitted. That is why I'm telling, whenever you have some doubts, or whenever you have the option, like whether it is option C or option D, you're confused between two options, you can mark for a review. Okay, so that you can come back, because last 10 to 20 minutes, you can come back to that question and then you can see. Okay. See, there is one more. Dr. Sanjana asking a question. Karnataka students, should they write PGCT? No, there is no PGCET as such. What exactly happens is you have to give your AIPGT examination. After the AIPGT examination is done, there will be results out by AIPGT. It is the national level rank which is given to you. After that, what happens? They usually give the in charge to the KEA, that is Karnataka Examination Authority. If you are a Karnataka student, you have already know that through UG you might have taken a state quota seat. You have to come to KEA Malleshwaram. So there again, there will be a counseling. So after that counseling, you will be given a option entry option. So where you can select your colleges. It is all online process. Only for counseling you have to come for Malleshwaram and get all your documents verified. There is no one more exam. AIPGT you have to attend. After that the seats will be allotted to the KEA. So after that they do the counseling. So they from there whenever the state based on the number of seats it is classified, and then if you are a better rank student, if you are getting based on your available college, you can get the seat accordingly. Okay. Sir, qualified marks for AIPGT 2025. So Dr. Priyanka is asking what is the qualified mark for AIPGT 2025. It's not, for qualification you should have that 50 percentile of the mark. So usually if it depends on if you're general merit it is like 50 percentile. So easily you can qualify. So nothing like that. So all the like ranks will be allotted. Even if you get less marks, your ranks will be allotted. But only thing it depends on if you're a good rank. Say for example, if you're joining BDJT Homeopathic College, if you are getting a good rank, you can get through state quota, or you can get through the management quota. So that is how the option is. Sir, how to manage negative marks? As I told, it is a very individual perspective. Okay, so where you need to understand and you need to mark based on your subject appetite and based on your risk factors. But one thing I would say, if the question is very difficult, you're not very sure, you're not heard the question only, please leave that question. And whenever you have optional doubt between two options, please attend it. Okay, because sometime what happens, gut feeling will be right. You know that option C can be the answer. Okay, whatever you get on the instant, you can attend it. So any other questions?
How to manage?
And also fill the form of BDJT Homeopathic Medical College, and there is also free mock test given. Okay, so please attend it. These are all high yield questions.
Dr.
Okay,
Kiran
so because
Kumar,
three high yield MCQs can lead to three high yield tests can definitely lead to a better marks. You will see, because sometime what happened, you might have attended that question in the grand test. Okay, so you might have attended that question in the mock test. What exactly happens is the same question might come up in your AIPGT examination. Okay, so the moment you see the question, might be in the mock test you might have done that question wrong, but on the day of examination there is a chance to correct it. Okay, so that will be definitely helpful.
Dr. Kiran Kumar, so one more question that Priyanka has asked: how to manage negative marking?
Yeah, I think I answered that question. So as I told, negative marks, no, that's why the main thing of managing negative marks is you should not attend all the 120 question. Okay, because there is already set of question which are framed not to answer it. Okay, so which are framed not to answer it, that will become a negative. And when you have doubt between two options, you go for it. Like as I told, if you're able to rule out two options and direct answers, you can answer it directly. Okay, but make sure you are in the limit. So not attending 120 and 120 entire option is not a good idea, because generally if you're able to answer the question 60 to 70 correct, and if you're also preventing the negative marks, it is a very good score. Yeah, any other questions from the participants?
Okay, thank you. Thank you, Dr. Kiran Kumar. Once again, I thank you for giving valuable information.
Thank you, ma'am. Thank you for the opportunity and pleasure that I would do this orientation.
Thank you. We will be releasing mock test series for those who have registered. That mock test series will start from June 9. So I request everyone to register yourself to get into mock test. Now I call Dr. Monica Katti, Professor, Department of Organ and of Medicine, for vote of thanks.
Good afternoon, everyone. It is my privilege to deliver the vote of thanks for today's event, which has been a resounding success. First and foremost, I want to express my sincere gratitude to our principal, Dr. Anand Hossur sir, for taking the initiation of conducting this AIA PGT orientation program and bringing us all under one umbrella. My sincere gratitude to Shri Iresh Anjadgeri sir, Working President, Dakshin Bharat Hindi Prachar Sabha Dharwad, and former Mayor, HDMC, for his untiring support to this event. I also extend my heartfelt thanks to JIGNASA for providing us a platform for this fruitful event. A special thanks to Dr. Kiran Kumar, Faculty of Materia Medica of Homeo Elite, for briefing about their app and conducting the orientation program for guiding the aspirants. I thank Dr. Kiran Gaddi for briefing about the institution and throwing light on the significance of today's event. My heartfelt thanks to Dr. Vijayalakshmi Nalvadi for the smooth conduct of today's event. Last but not the least, I thank all the participants who made this event a huge success. Stay tuned and stay connected for more updates. Wish you all good luck. Thank you, one and all.
Thank you, one and all. Please note the dates of mock test. June 9th will be the first mock test. Then June 16th and last mock test, that is third one, June 30th.